my name is Joanna Greer-McEachin, and I would like to introduce you to ABIPA. What is ABIPA? It is the Asheville Buncombe Institute of Parity Achievement. So our founder, Dr. Charles Blair, is really important to the trajectory of ABIPA. I like to begin with him all the time, even though we have since gone 18 years almost now, because he is the foundation for what we do. And even though he started, I feel like the work of ABIPA now is a marathon, and I'm carrying that torch right now. And through that torch, I know that community collaborations are key. And so I would like to share with you some of the things that ABIPA has been doing over the last year or two. ABIPA promotes economic, social, and health parity achievement for African Americans and other underserved populations through advocacy, education, research, and community partnerships. ABIPA is a trailblazer in addressing community health. We were established in 2004, and we're addressing social determinants of health and utilizing the community health worker model before either concept became buzzwords. This has grounded us as a premier grassroots organization that specializes in active engagement of public health and healthcare and community organizations to successfully locate, educate, navigate, and advocate health equity for African Americans and other underserved populations in Western North Carolina. Our targeted focus is to support Blacks in our region because of the historical and present-day racial marginalization that has negatively impacted overall health outcomes.
I've been doing this since 2013, and we started just by going into the community, knocking on the doors, and people letting us in and just telling us what's going on in their life. A great community health worker is a trusted community member. We find out medication issues that the client might be having. We find out if the client is lacking with food, clothing, clean water. Those are things that the doctor cannot get into when they're in the clinic with the person trying to address health care concerns. So we're able to do that for the doctor, and then we can work as a team to address those needs for a better health outcome. A community health worker can support a practice in achieving success by being the middleman, per se. While the doctor is in the clinic working with patients, the community health worker can be boots on the ground, having an intimate, personal, one-on-one with that client, and that's really how you build that relationship.
We also know that the effects of poverty and systemic racism crosses color lines, so we promote a culture of health for all and are here to support all of our neighbors that can utilize our services. With this in context, ABIPA helps to shape and influence supportive interventions for health needs while providing resources to address the overall well-being of the individual and their ability to adequately access preventive health education, interventions, and health care. We provide a cross-reference of resources and are known for bridging relationships and building trust in public health and on the street. Our dynamic reach to the African American population of Buncombe County and beyond, coupled with the successful organizational partnerships, have been fostered as a direct result of working with ABIPA. We are excited about this work that we are doing in Asheville and the surrounding communities. We have successfully helped address the concerns in many congregations in Buncombe County and Henderson County, as well as across the region, that include low-income, uninsured, and underinsured in Western North Carolina, because we go to people where they are with passion and commitment. We are dedicated to building a nurturing system where the healthy option is the easy option. ABIPA's goal is to bring our services to communities, elevating the innate power that people have to improve and change the quality of their personal health through prevention and self-management. In the wake of COVID-19, our little dream was to distribute 1,000 masks, but it was realized as more than 100,000 masks given out to support COVID-19 prevention. We have hosted and aided in numerous testing sites and vaccine events. As partners with MANA and Buncombe County, we have served over 7,281 individuals, 106.17 tons of food through our community engagement markets.
I've been working for ABIPA since 2013, since the beginning of the community engagement markets. They used to call it the pop-up markets back then. I started out volunteering before I got hired on, and they allowed me to teach my HIV class there in their office. And that's how it all got started, volunteering first. I'm a type of person, I tend to put myself in other people's shoes. I mean, I've been without food before, I've been without lights and water and stuff before. We're a paycheck away from being homeless. So, you know, if you put yourself in their shoes and understand the issue, I think you have a better way of being able to serve people. And I enjoy just helping. That's a ministry of mine. I have a ministries of helps. So I enjoy helping people as long as I can get them the things that they need and they have a smile on their face and they come back and say thank you.
I like helping people, just being honest. I like doing stuff for other people. I run this community center. Usually I'm the first one here, so I come in, they come in, beat the truck, we unload the truck, sort the stuff out, and you know, then we make sure we get our elderly boxes made first, and then all the other stuff that we have left over, that's for the community to come in and pick what they want.
I know what it's like to be on the other side. I know what it's like to have nobody have your back. I know what it's like to have nobody listen to you. You see what I'm saying? So if I can make somebody smile just by passing you food, then that's what I'm gonna do, because I know what it feels like to be sitting there and you just at your worst and don't wanna move. But if you can help somebody smile at the end of the day, that's what I'm here for.
We have given out more than 1,000 sanitation care bags, and we are still able to support our neighbors who live in the far west region with aid. We were able to host our chronic disease self-management classes virtually. We were able to be a fiscal sponsor for 3 organizations, pouring $45,000 directly back to them and supporting their services to the community. As a true reflection of how we are grounded in collaboration, we co-hosted pop-up housewarmings for new moms who needed support. We co-sponsored the Black in Black on Black art exhibit at the Center for Craft that highlighted the research culminating a 3-year Robert Woods Johnson Foundation project. Finally, in 2021, we collected toys and books of color for over 200 children for our 2nd annual Christmas Joy Toy Drive-Thru, which was a direct response to COVID. So instead of us doing our annual Christmas party in person, we actually had our parents drive through and get their gifts for their kids.
So ABIPA has been doing this for quite some time, about 10 years now, and it's very important now, so more than ever, because of COVID, and a lot of people have been hit really hard with finances, and we want to be able to give back to the community that we serve. Last year we had served just over 100, but this year it really picked up, and we were able to serve and get gifts for over 200 children. So some of the gifts that we were able to give out this year included Black and brown books for young Black children, and that were donated by Rock the Mic, with toys like Ada the Scientist, which I didn't even know that there was a young Black scientist named Ada. So these are some of the gifts that ABIPA has been able to provide for our young children this season. A lot of people aren't able to give back, so ABIPA has made a way to give back to the community. So what's great about the toy drive this year, we have been able to expand in so many ways. So this year we want to give a huge thank you to our sponsors. We've got Strictly Wings, we've got Stephanie's Hair Design, Small Cakes, and then also New York Fashions. And we've also got the Grind Coffee, who have made a huge impact with the toy drive this year. The work that we do with ABIPA is a lot of the work that we do serve the communities that I grew up in. I'm a native of Asheville, so for me, it hits home. We help through food drives and getting resources for people. So a lot of those things I didn't know about even when I was growing up. So this really, the work that we do here with ABIPA really hits home for me.
We are small, but we do impactful work because of the support of our programming funding partners and friends of ABIPA, which include Buncombe County, Dogwood Health Trust, WNC Bridge Foundation, RHI Legacy Foundation, MAHEC, the YMCA of Western North Carolina, UNC Asheville, Robert Woods Johnson Foundation, Community Foundation of Western North Carolina, AARP, and Bank of America. We believe in being the change we want to see. That is why we continue to support the Minority Medical Mentoring Program to help grow our own local health professionals. We champion current efforts of recruitment and retention of Black doctors. Whether it is health education, know your numbers, prostate cancer or breast cancer screenings and outreach, food insecurity support, virtual programming with AARP, congregational health support, community health worker interventions, and COVID response messaging and support, ABIPA is your community health connection that serves locally with a regional reach. So how do we do what we do? With passion, with purpose, with professionalism, and with amazing partnerships. For more information on ABIPA and our programs or how you can partner with us, go to abipa.org or follow us on Facebook at the Asheville Buncombe Institute of Parity Achievement. Thank you.